আপনি কি রাতে 10 বার টয়লেটে যান? Are you having recurrent urinary tract infection? Are you having recurrent burning during micturition? Are you afraid of cancer? Don't worry. Features of prostatism doesn't mean you are having prostate cancer. Hello friends. This is Dr. Arghya Basu, gastro and cancer surgeon, welcoming you all to a very interesting episode of your own YouTube channel Arghya, where we discuss various gastro, cancer and surgery related problems and try to help our patients and viewers with accurate and state-of-the-art medical guidance even at personal level. Hello friends, this is Dr. Arghya Basu, gastro and cancer surgeon, welcoming you all to one more interesting episode of our healthy chit chat on prostate and its issues. Prostate is a gland which is exclusively found in males. Prostatism is not found in females because females do not have prostate. So these prostatic problems exclusively occurs in males. Prostate gland typically causes two types of problems. One is benign enlargement and other one is prostate cancer. Now see, prostatic enlargement is not a disease. It is just like cessation of menstruation in females after 45 or 50, we consider it a physiological phenomenon. Just like that, after 50, enlargement of prostate gland is a normal physiological phenomena for all males. Why does it occur? Because after 50, the amount and quantity of male hormones like testosterone and dihydroepiandrosterone drastically falls in a male person's body, in a male person's blood. As an effect, the prostate gland of that person continues to grow. This is called BHP or benign hypertrophy of prostate. It is also called BPH or benign prostatic hyperplasia. It is not cancer. The other one is prostate cancer. Why we are afraid of cancer? Because whenever we are having some symptoms of any specific organ in our body, we are always afraid of cancer, because cancer gives you a painful death. But don't worry, prostate cancer is also one of the good cancers, because even if at stage 4 or metastatic settings, a prostatic cancer patient can live for more than 15-20 years if he is following proper treatment protocols under a proper guidance. Now let's come to the anatomy. What is prostate? A prostate gland is a gland that is situated just below the urinary bladder. Our urethra or the urinary tube actually passes through the prostate. So when a prostatic enlargement occurs, the patient typically has bladder outlet obstruction. The bladder and urethral junction becomes narrow, so that the bladder outlet is narrowed and the patient faces various difficulties related to urination. What are those difficulties? Whenever the patient is having little amount of urine accumulation in the bladder, he starts getting sensations of a full bladder and he has to run to the toilet. But whenever he runs to the toilet and he presses his tummy to pass urine, he gets bladder outlet obstruction. He cannot pass entire amount of urine. A half amount of urine is passed and the patient feels relieved. He comes back and sits in his chair, and again after a few minutes he feels the same urge to pass urine because of the same phenomena. So the patient has to run to the toilet recurrently at very small intervals of time. This is called increased frequency of micturition. And when a patient's bladder is not getting emptied recurrently, immediately, every time, so definitely there is stagnation of some amount of urine in his bladder every time. And urine is like a Domino's pizza for bacteria. So these different kind of bacteria continue growing in infected urine, and the patient gets recurrent urinary tract infections, which makes his life horrible. Always remember, BHP or benign hypertrophy of prostate affects the inner part of prostate gland. So that whenever there is benign enlargement, it always affects the process of urination and the patient gets features of prostatism. On the contrary, whenever it is a case of prostate cancer, the growth occurs on the outer surface of the gland. It involves the peripheral or external aspect of the gland so that the gland grows outside. And as the urethra or urinary tube is passing through the substance of prostate gland and the gland is growing outside, it is just like Kolkata is growing towards the south and towards the north, towards Rajarhat and towards Goria, but the central Kolkata is unaffected. So the central part of urethra or urinary tube remains unaffected. So prostate cancer patients usually do not have a single symptom of related to urination. That's the beauty. Please listen to the video till the very end so that you don't miss any vital point, and at last where I will share with you the links how you can get in touch with me and get personalized advice and guidance. Now we will go to the treatment and further discussions part, but before that, if you are enjoying the show and अगर आपको कोई benefit मिल रहा है तो please ये चैनल को सब्सक्राइब कर लीजिए एंड बेल आइकॉन को प्रेस कर दीजिए so that you will get notification every time we post a video, and this will give me and my team a huge inspiration for our hard work. Thank you. Now without any further delay, let's dive deep into the problem and how we are going to tackle it. So whenever you are having symptoms of related to urination, you can be rest assured that you are having benign hypertrophy of prostate or benign hyperplasia of prostate. It is not malignant. Rather, prostate cancers come to our OPD with bone pain. Now you will get astonished. Where is bone pain coming from here? Because the growth is towards the outer aspect of prostate gland. It is not producing any pressure effect on the urethra, so the patient is living fine, fit and fine, living a healthy life. But the cancer is spreading through vertebral venous plexus into his vertebra or other bones in the body. So whenever that disease is spreading to vertebra and other bones, it is ultimately eating away the bone and it is causing severe bone pain. 90% of the patients of prostate cancer presents to an oncologist with excruciating bone pain and no other symptom, because these diseases are diagnosed only because of bone pain. Whenever the patient is having excruciating bone pain, he thinks that it is an orthopedic problem. He visits an orthopedic consultant who advises a few x-rays. On the x-rays, numerous lytic lesions are found. Lytic lesion means a disease which is ultimately eating away the bone. Whenever a lytic lesion is identified in the x-ray, then the orthopedic surgeon eventually transfers or refers the patient to a surgical oncologist or oncologist, who then performs the staging investigation related to that patient. Whenever prostate cancer has spread to the bones, it is already stage 4 or the last stage of prostate cancer. But don't worry, as I said earlier, even stage 4 prostate cancer patients, if treated properly, they can live for more than 15-20 years without any symptoms. Personally, I have a good number of prostate cancer patients who are living normal healthy lives and performing trekking and high altitude activities even with stage 4 disease. So don't worry with it. Even if it is a prostate cancer, we perform just bilateral orchidectomy or removal of testes as a part of hormone therapy. We initiate only a few tablet hormone therapies with which most of the patients remain under control. Only if the prostate cancer is a poorly differentiated cancer or moderately differentiated cancer, that is, it belongs to a poor variety, it tends to grow even with hormone therapy. Only in that case, chemotherapy or other hormone therapies needs to be initiated. Otherwise, prostate cancer is a good cancer. It is a treatable cancer, it is a curable cancer. But whenever you are having prostatic symptoms, urinary symptoms, think more about BHP rather than prostate cancer. BHP is much more common than prostate cancer. Eventually, it is bound to happen in every male person's lifetime in his or his body, because growth of prostate due to hormonal effects is a physiological phenomena. It is not a disease at all. So don't worry. However, you should keep a low threshold, and whenever you are having urinary symptoms recurrently, you should visit a surgeon or a surgical oncologist or a oncologist and make it sure that you are not having prostate cancer. Whether you might visit a urologist also to get treatment for your benign prostatic hyperplasia as well. You can get connected with me and follow my posts, videos and blogs in my social handles given in the description box just below. If you want a personal consultation with me, please WhatsApp or call in the following numbers. My team members will personally get in touch with you as soon as possible. So friends, hopefully आज का सेशन आप लोगों को अच्छा लगा होगा and you might have gathered some few more informations that you didn't have yet now. आपके मन में जो भी सवाल होगा, please mention them in the comments section. I will try to reply them back as soon as possible. So here is your friend Dr. Arghya Basu, gastro and cancer surgeon, signing off for today. We will be meeting in our next interesting video very soon. Till then, take care, bye bye and Jai Hind.